Hi there, my name is Jasmine, and this is my presentation on the role of serotonin in neurotransmission. Today I'm going to be talking about how exactly neurotransmitters play their essential role in brain function through transmitting signals between neurons to regulate various psychological and physiological processes. Serotonin in particular is so important because of its involvement in mood regulation and emotional stability and mental health. So this presentation is going to provide a very in-depth look at exactly how serotonin functions, what happens when its levels are imbalanced, and how medical and lifestyle interventions can help manage serotonin and any of the serotonin-related disorders. Serotonin is synthesized in serotonergic neurons from the amino acid tryptophan. It plays a vital role in synaptic transmission through binding to various 5-HT receptors to modulate neural excitability and signal transduction. Beyond the central nervous system, though, serotonin is also found in our gastrointestinal tract, where it helps regulate digestion. In the brain, serotonin functions extend to mood regulation, sleep cycles, and cognitive processes. Serotonin synthesis occurs in a two-step process, and it involves tryptophan and L-amino acids. So following its release into the synaptic cleft, serotonin binds to the 5-HT receptors on the postsynaptic neuron, initiating a signal cascade. So the serotonin transporter, or SERT, reuptakes excess serotonin, while monoamine oxidase, MAO, breaks down unused serotonin into inactive metabolites. These processes regulate serotonin availability and influence effects on mood, on behavior, and how our brain functions. Serotonin is just so important. Serotonin deficiency is a major factor in mental health conditions, particularly depression and anxiety. So a reduced serotonin level can impair our mood regulation, which leads to sadness, irritability, sleep disturbances, impulse control disorders, including aggressive behavior or anything that is a compulsive behavior, can also be linked to a serotonin deficit. Understanding these effects is critical for developing targeted treatments to restore serotonin to its efficient balance. SSRIs, SNRIs, and MAOIs are all widely used to treat mood disorders by increasing the serotonin levels in the brain. SSRIs such as fluoxetine, otherwise known as Prozac, selectively inhibit serotonin reuptake, enhancing its effects. MAOIs, though less common, prescribed due to dietary restrictions, block the serotonin breakdown by inhibiting MAO enzymes. Psychedelic substances like MDMA and LSD directly interact with serotonin receptors, which cause it to have a altered perception and, in the end of that all, mood enhancement. I also created this diagram here showing the different medications, what they're used for, the mechanism of action, the effects on our serotonin, and how it is clinically used. Serotonin's role in emotional regulation means that its deficiency is strongly associated with psychiatric disorders. MDD patients often show a reduced serotonin level, which affects their ability to experience pleasure and regulate emotions. GAD and OCD involve disrupted serotonin transmission, leading to anxiety and compulsive thoughts. Since serotonin also regulates melatonin production, a deficiency can cause trouble with sleep and contribute to insomnia. SSRIs and other pharmacological interventions are effective in treating serotonin-related disorders, but non-pharmacological approaches can also play a very critical role. CBT, Cognitive behavioral therapy and mindfulness techniques can actually rewire thought patterns to improve mood regulation. Another very important factor is diets that are rich in tryptophan, which is found in foods like turkey, eggs, and nuts, help to support our serotonin synthesis. Also, regular physical activity and exposure to sunshine can naturally boost our serotonin levels, which promote mental well-being all around. So I just went over serotonin's crucial role in brain function and how it connects to mental health. Understanding how serotonin deficiencies contribute to different disorders allows for a more effective treatment strategy. Pharmacological and lifestyle interventions together can provide a holistic approach to maintaining optimal serotonin and overall mental health and well-being. Here are my references. And as a bonus little slide, I wanted to add a little bit more on holistic healing practices aligned with regulating serotonin in a more natural way by promoting relaxation and emotional balance. A lot of research has shown that mindfulness meditation does enhance serotonin production by reducing our stress hormones. Ayurveda also has principles that emphasize dietary habits that support serotonin synthesis. They suggest consuming a lot of foods that are rich in tryptophan, so nuts, seeds, and dairy are all wonderful for that. And additionally, yoga and pranayama, which is breath work, both activate the parasympathetic nervous system, which can aid in our serotonin balance as well. Lastly, Reiki healing is also associated with stress reduction, which indirectly supports serotonin regulation. Thank you so much for watching.